This is a redlining map from the Housing Home Ownership Loan Corporation, which is a federal organization back in the 1930s and 40s. And they produced these maps at one time. These maps that basically rated residential security. And residential security is basically, there are places where banks should invest money and places where banks should not invest money. In other words, there are places where mortgages should be made and written. There are other places that mortgages should not be underwritten. And so they rank them from first grade down to fourth grade. Fourth grade is basically toxic. Do not invest in these areas. This is the federal government telling localities that these places are toxic. And these are being interpreted. In fact, they were sort of, the information for them was fed into them by local real estate brokers and local bankers to create these things. Probably the federal government didn't intend for these to have a racial impact. But the local real estate brokers and the bankers certainly did. Next slide. So we transposed this into a GIS to show you what it looks like in Oakland. Hit it one more time. And this is, each dot there represents 200 African American families in 1940. Hit it again. This is African Americans in 1950. Again, African Americans in 1960. So African Americans didn't just choose to move to these red places. This is where they could live because of racially restrictive covenants. And then the federal government, in their great wisdom, decided that no investment should be made in these areas. Next slide. So you can see, this is, I'm overlaying now one of those death hotspots where life expectancy is less than 72 years. That's one of them, hit it again, and that's another one. So how random is this? And why is it not important for us to understand the history and legacy of these practices that were intentional, man-made, intentional practices and policies that can be unmade by people like the people in this room? But we have to know about it, we have to understand the implications of it before we just say, you know, this is about people smoking too much. Next slide. Okay, so how does segregation affect health? It can determine the quality of education and employment opportunities. I'm going to show you some education data in a second. It can create pathogenic neighborhood housing conditions. Conditions linked to segregation can constrain the practice of health behaviors and encourage unhealthy ones. In other words, shape the social environment in a way that certain behaviors are acceptable and others are not. And it can adversely affect access to high-quality medical care. Next slide. Okay, hit it again, and again. All right, so you may have grown up in a house that looks like this and a neighborhood that looks like that. I actually did. I grew up in a very nice neighborhood, hit it again. And I think that it shaped the way that I feel about my life. I honestly feel like I was valued and that I had every possibility open to me in life. And I think it explains why I went to medical school and law school and did all these crazy things, because I thought that everything was doable. And I think that when you grow up in a place like this, there's messaging, there's feedback that tells you that you're valued. Next slide. But what if you grew up in it again and again in a place like this, and again and again? What if this was the park that you played in? These are places from East Oakland. This is a park that we actually are working to try to improve. What's the message here? And these are places that were redlined and didn't have racially restrictive covenants. These were places where African Americans and subsequently Latinos and Asians, Chinese, could live because they couldn't live in some of those green areas. And so generations after generations lived in these areas. And the ability, many people own their homes in these areas. The ability to essentially increase equity, to get mortgages, to take equity out of your house to fund college education, to make that intergenerational wealth transfer that is so important to American success, was denied these populations. And it has health consequences. And we act as if it doesn't. We act as if there's just bad behavior that explains this. Next slide. Okay, we're talking about land use. And we have to think about other decisions that have been made intentionally, policies that have health consequences. This kind of design is very, very, very difficult to navigate on foot. Next slide. As is this. This poor person is trying to get across the street. Not quite sure what they're trying to get to. All they have is fast food and gas. But nonetheless, this kind of design, it basically says cars matter more than people. And therefore, you should spend more time in your car and less time on your feet. Next slide. again. Okay, so since 1975 to 1995, we've seen a decrease in walking trips, basically flat level of bike trips. Next slide. We also see this notion of commuting that compared to 1969, Americans drive 88% farther to shop, 137% farther for errands. Moms are spending an inordinate amount of time in the car, 64 minutes on average. Single mother, 75 minutes. Next slide. We've seen basically the percentage of, I like doing this, it's fun. A friend of mine showed me how to do this. How many of you walked or biked to school when you were a kid? There you go. How many of you have children that walk or bike to school? So just look around. Things have changed, and that has an effect on health. Next slide. We've seen increasing vehicle miles traveled on a per capita basis, so this takes into account population growth. Next slide. This is an international comparison with the U.S. on the left, Canada, Germany, and Holland, looking at bicycling and walking. So lifestyles do matter, but environment does shape these lifestyles to some extent. Next slide. We know that sprawl has been scientifically linked to obesity. Those living in sprawling counties are less likely to walk, more likely to weigh more, have a greater prevalence of hypertension than those living in compact, dense counties with an average 6-pound difference. Next slide. People who live in neighborhoods with a mix of shops and businesses within an easy walking distance have a 35% lower risk of obesity. So what our friends in planning do matters a lot to what we end up having to do in health. And that's why they're critical partners for us. And that this gathering is all the more critical. Next slide. I said this a little earlier, population growth is being outstripped by vehicle miles traveled. Next slide. We have the average time it took to get to work and commutes going up by 14% between 1990 and 2000. Next slide. And this is some comparison. You can't see this, but there are 2 Ohio counties here. This is looking at dense counties, which are in the blue, versus essentially sprawl counties, which are in the brown, and looking at the average annual traffic fatality rate. And what you can see is that the more spread out you get, the more likely you are to get hit and killed by a car. And there are 2 Ohio counties in there. I'm not going to try to mispronounce it like I did yesterday. Cuyahoga, thank you. I called it Cuyahoga or something. Next slide. Okay, and similar data here, hidden here. You see this sort of relationship as areas become less dense, vehicle trips become essentially more common. So the cars and how we design our communities are directly related. And there's this really steep sort of inflection points between 3 units per acre to 20 units per acre as things get much denser. Actually, not that much denser. You see the vehicle trips drop off dramatically. Next slide. Okay, so the health impacts of land use planning are, hit it again, increase in air pollution, increased car crashes, increased pedestrian injuries, decreased water quality, decreased mental health, decreased social capital, decreased physical activity. All of these things are relevant to health. All of them. Next slide. We think that when we look at health inequities, they're driven by social inequities. And those social inequities are manifest outside the health domain. So we have to work with partners outside of the health domain in multiple different sectors in order to actually try to improve health. And land use and planning is critical. We know that income and employment is critical. Education, if you ask me, is probably the #1 thing. And I'm going to show you some slides in a minute. But all of these so-called social determinants of health are driving health outcomes. And the extent to which we use the medical model, we ignore these things. And if we ignore these things, we're not going to eliminate anything. Next slide. Okay, so who decides how these communities are laid out? Hit it again.